Okay, Bismillahirrahmanirrahim. Right, ladies and gentlemen. Um, Somebody had requested for a video presentation regarding morphology of the ovarian tumors. So here it is. Remember, we'll talk about this as this video is intended for undergraduate students. We'll talk about the most pertinent points only that are important with respect to your exams. Um, now, when we start talking about ovarian tumors, here's a list of different tumors. You can see they're divided into different groups. Um, First is the surface epithelial stroma tumor group. That you can say surface epithelial tumors. Then the second tumor is the sex cord stroma tumors. Another group is the germ cell tumors, and then there are metastatic cancers that can come from different sources like colon, like stomach, like breast, etc. Okay, so of the surface epithelial tumors, uh, for you to remember, the most important ones for you to remember are the serous tumors, the mucinous tumors, and um, yeah, these two are the ones that are most important to remember with respect to ovary. Now I'm talking about ovary, okay? Serous tumors and mucinous tumors. Although endometrioid and clear cell tumors can also be seen commonly, then there are transitional cell tumors, which one will example we'll see shortly. Uh, of the sex cord stroma tumors, you should at least remember the names: granulosa cell tumors, fibromas, fibrothecomas, sertoli cell tumors, and morphology of some of them, at least the ones whose pictures are given in your books. And then the germ cell tumors, very common, particularly this tumor, teratoma, and of which the mature cystic teratoma is the most common one that is seen. Then there are dysgerminomas, yolk sac tumor, and mixed tumors as well. Now we first move on to the serous tumors. Um, this is example of one example of gross morphology, how it looks like. You can see in picture A here, you can see there's a cyst that has been opened up, and what is the evidence that it was a cyst? You can see this membrane like structure, this flap like area. This tells you that it was a cyst that has been opened up, and in this region you can see there are some papillary kind of structures. Okay, so this is a serous papillary tumor. This is most likely going to be a low grade serous carcinoma as it looks on gross morphology, but things can change on microscopy. This is a tumor. This is an example of a high grade tumor. You can see there's more of solid areas, more of you can see in this region, here, and here, more of solid appearance than cystic appearance. But again, it is a cyst that has been opened up and shows multiple solid areas. So likely scenario, um, in an OSPE, somebody might say that a patient presented with so and so symptoms. We'll talk about um, some biochemistry as well. Substances can be raised in the peripheral blood, in the serum. But okay, for now, somebody came with was diagnosed to have a tumor, and this is the gross morphology. There was some solid and cystic appearance, um, and there are some papillary areas. Most likely, they're going to ask about a serous papillary tumor. It can be serous cyst adenoma. It can be serous cyst, it can be a carcinoma as well, both low grade and high grade. If somebody is going to ask about a serous cyst adenoma, most likely picture they're going to give is maybe somewhat like this. The picture C, concentrated picture C, and only on the upper part of it, this region. Okay, the upper part of the if it's a cyst that doesn't have any solid areas, it's a thin cyst. Somebody describes in a scenario that it's a thin cyst, no solid areas, most likely diagnosis. And you consider on histology as well that it's a serous tumor. It's most likely going to be a serous cyst adenoma. Now, people make mistake in this regard. Somebody they write if it's a serous tumor asked, they write it mucinous, and if it's mucinous tumor asked, they write it serous. There are a few particular differences. Now, on morphology of serous tumors, this picture A is an example of a serous adenoma. Now, you can see these are tiny papillary kind of projections. This is the underlying stroma in this area. This is the surface epithelium, which is lined by columnar cells. This is the main histology you're going to remember. Now, what has happened in this area, that there is increased architectural complexity and there is a bit of atypia as well. Okay, so this might be a borderline tumor. These are divided into benign, borderline, and malignant tumors. Okay, benign encompasses what is known as the serous adenoma, and then there are borderline tumors like this one, and then there are tumors which are considered as carcinomas, both low grade and high grade. We call them carcinomas only when we have on sections a thing that is known as invasion. You're familiar with the word invasion now. How it looks like this. Okay, now the tumor cells have invaded into the stroma, and this is likely a carcinoma. If you don't remember it as low grade, high grade, at least try it that it's a serous carcinoma. Now, if this is the picture that has been given, okay, why are you saying that? Because invasion has occurred in this region. You don't see invasion here, and this is the most benign example. This is a borderline example, and this is an example of a cancer. Now, another picture. This tumor presents with a particular history in the scenarios given in exams. Now, how would you describe the specimen as? You see a structure that it's a cut surface that has a spongy or a multicystic appearance. Okay, and if somebody is going to ask you this tumor, most likely they're going to tell you that they have some shiny areas, some mucinous areas, some gel-like material. There may be a lot of words like that, okay, on cut surface. Okay, so remember this particular morphology on gross, somebody writes it like that. This is not the case with serous tumors. Okay, and then this is the histological picture. Now, this is an example of a mucinous tumor. Okay, a mucinous cyst adenoma. What is the difference from serous tumors? Now, you see a columnar kind of epithelium here as well in this area, okay, but you see mucin that is seen in the upper part of this epithelium. At least remember this thing. Remember, you won't make a mistake. You won't write mucinous as serous or serous as mucinous. Okay, if you can recognize this is a tumor lined by a single layer of epithelium here, and then there is mucin in the upper part, some mucinous material in the upper part, or some bluish material in the upper part. You can remember any way you like it. Uh, um, this is a mucinous tumor. This is a mucinous cyst adenoma. Okay, now we move on to the next tumor. This is a very common tumor. Uh, this also has a cystic appearance. You can see in this region, this is a cyst that has been opened. That has been opened up. And what do you see if somebody asks you an ovarian tumor, and this is something that is visible? What is this? This is a tuft of hair. This is a ball of hair. This ball of hair, if it's visible, you straightforward for you, it's a teratoma. It's a mature cystic teratoma, based on his gross picture at least. These are the cystic areas, okay, here in this region, and this is the ball of hairs. Somebody also might write that some sebaceous material, some greasy material was also visible when the cyst was opened up. Somebody might say that some tooth were visible on gross inspection. Somebody might say that skin was visible. Somebody might say that bone was visible. There can be a lot of variations, but the main point is that different components derived from different germ cell layers can be seen this tumor. This is an example of mature cystic teratoma, and this is how it looks like. We discussed it a lot during the practical videos as well. The different components can be seen. Skin can be seen on the surface. There can be cartilage, there can be bone, there can be spacious glands, okay, so on and so forth. Now, this is a tumor which you should recognize, um, because you should recognize easily that you have seen this kind of a tumor in the testes as well. This is a tumor that is the ovarian counterpart of a testicular tumor. Testicular tumor, if I tell you that it's section from the testes, there are polygonal cells, there's some clearing of cytoplasm, and then there are lymphocytes. There's a lymphocytic infiltrate within the septa, or the tumor is divided into lobules by the septa, etc., etc. Your answer is going to be straightforward, that you're talking about a seminoma. This tumor in the ovary, this picture in the ovary is known as this germinoma. So remember, this is an ovarian counterpart of testicular seminoma. And this is how it looks like on histology. Now, this is another tumor. If somebody asks you, gives you a scenario somewhat like a mass, and then peripheral blood smear, somebody detected raised alpha fetoprotein levels, and then there on histology there's a vessel in the center like this is a vessel in the center. You can see RBCs in the center, and the tumor cells are arranged around those vessels like this. You can see like it's like a picket fence that is arranged. The picket fence word is not used for this tumor, but if you imagine this is a vessel, and like a picket fence, it's the cells are arranged around it. This tumor, in combination with the information you have, the raised AFP levels, and then they say that there are structures on histology with the central vessel and tumor cells arranged around them. This is a yolk sac tumor. Remember these few particular points about a yolk sac tumor. Okay. Now, this is a tumor that can occasionally be asked in an OSPE. If somebody gives you a scenario that on histology doesn't have a very particular gross morphological picture as far as undergraduate level is concerned, but if somebody tells you that some follicle-like structures are seen on histology, if you concentrate in this region, okay, here, this is a follicle-like structure. If you look closely, here's another one. Okay, if you look closely, there's another one. You can see, you can imagine thyroid follicles. Okay, follicle-like structures, not follicles. Remember, I've not said follicles. I'm not talking about the struma ovarii, where actual thyroid follicles are seen. I'm not talking about that. I'm talking about this tumor. This is known as granulosa cell tumors and shows some follicle-like structures, somewhat like these. Okay, a few of them I've highlighted for you. This is a typical golden brown appearance of this tumor. Now, here's another tumor. Occasionally, somebody might give you a scenario that tumor, raised serum markers, there's a strong CT scan suspicion and clinical suspicion of an ovarian tumor. This is the histological picture. Histological picture is that there are a lot of tubules now. Okay, this is one tubule, this is another tubule. There are a lot of tubule-like structures or tubular structures. Okay, so then you know that they're talking about a sex cord stromal tumor. Okay. Now here's another tumor, a benign tumor. If somebody gives you on histology an example, there are nest-like structures, benign appearing, transition with showing some transitional epithelium-like areas. Okay, like this one, like this one. So you know that they're talking about a Brenner tumor. Okay. Now a little bit of stuff about the pathogenesis of the ovarian tumors. Now, some people like to ask a question, why I've included this picture here in this presentation, that some people like to ask that enlist or classify the ovarian tumors as type 1 and type 2. So what is that? Generally these are considered as the type 1 tumor, low grade serous carcinoma, endometrioid and mucinous, and they develop through this series of events, probably like a benign cyst adenoma developed, or a previous endometriosis, and mutations occurred, and then it progressed to a borderline tumor, and then to one of these. Okay, and serous tumors are now considered to be um, arising from the fallopian tubes, okay, or surface imagination of the imagination of the surface epithelium. Some inclusion cyst may form, and then later on, through a series of events, that's a detailed discussion, high grade tumors can arise. And then what is thick? This is an abbreviation for serous tubal intraepithelial carcinoma. Now it is thought the current thing is that serious high-grade serous tumors are the starting point of high-grade serous carcinomas is usually fallopian tube. Okay, so you should remember this thing as well. Now this is a good. I included this because it's a good summary of these things. How they are divided into benign, borderline, or malignant tumors. Most of them are benign in young women. Malignant tumors occur most commonly in older women, although malignancies can arise in young patients as well. We've seen some of them. And then how the prognosis varies. Three major histological types: serous, mucinous, and endometrioid. Um, Type 1 and type 2 divisions. Okay, type 1 being the low grade ones and type 2 being the high grade ones, and then the role of BRCA1 and BRCA2 gene mutations. This can be sometimes be asked as a STEM, 0.5 or 1 mark STEM occasionally. Okay, so this is a nice table that is given in your books for germ cells and sex cord tumors. You can try memorizing the histological features, the morphological features, and behaviors from this table as well. Now, here's a table from a paper that was published in 2018. You can see if somebody has got a mass in the abdomen, you suspect it's an adnexal mass in the lower abdomen, in the pelvis. CT scan appearances, so and so suggestive. Before that, you may want to carry out, you may want to perform some serum markers, and you see the percentage of serum markers that are detected in high numbers, in high amounts in the serum. Remember, of these two, of these, CA125, CA19-9 are very important ones that are mentioned sometimes in the scenarios. I separately mentioned AFP when I talked about yolk sac tumor. But remember, CA125, CA19-9, clinicians commonly perform these two on the peripheral blood when they are suspecting a malignancy of the ovary. You can see the 190. They actually worked on 196 patients, and this is what they found. Okay, another example showing another table showing the efficacy of the tumor markers. You can see here CA125 is mentioned again, CA19-9, CEA is also mentioned. So you should remember at least these 3-4 markers, so that when you sit an exam, you have a clue. If somebody gives you that so and so scenario, and then there are raised levels of these, at least you suspect that they may be talking about an ovarian tumor. Okay, and if they're very raised, most likely a malignant tumor. Okay, so this is it for now. Please let me know if you have any question regarding this presentation. Remember that this was designed for a specific purpose, for a specific exam purpose, to help you in grasping the most important points with respect to exam. I hope it is of some help to all of you. Thanks a lot. signing out for now.